Some of the other heroes connected to the shooting at Fort Stewart yesterday, the medical professionals who treated the victims. WSAV's Nakaya Harris got a look into how they responded to events like that.
Seconds matter, and soldiers who intervened during Wednesday's attack used that same mindset to save lives. That carries over behind these closed doors here at Memorial Health. I spoke to the chief of trauma about what happens when their team takes over.
You know, when those kids are 18, 19, 20 years old, they're putting their life on the line for the defense of their country.
Doctor and veteran James Dunn, who once served as chief of trauma in both the Navy and Army, says Wednesday's attack on Fort Stewart brought back memories of treating wounded soldiers.
That was essentially what my job was when I was in the Navy, taking care of the casualties that came back from Iraq and Afghanistan, mostly the U.S. Marines, but also the Army soldiers.
Now at a level 1 trauma center, he says the urgency, preparation, and teamwork he once saw in combat still applies here at home.
Once we get the call, the team will organize and we'll mobilize and we'll be down in the trauma bay waiting for those patients to arrive. And once they arrive, we're pretty good about treating them and figuring out what's wrong with them and getting them to x-ray and getting to the OR in an expeditious fashion.
Memorial Health can manage 66 critically injured patients at once.
Dunn says early action, like the soldiers who stopped the bleeding, can make a major difference.
The military is the leader, even in the civilian sector, about pre-hospital care. They wrote the book on it. TCCC, or Tactical Combat Casualty Care, is the best training course that's out there.
He says communication is key in a high-stress situation, and even without a mass casualty alert, staff was ready to move.
We weren't anticipating a mass casualty situation given the numbers, but we were certainly, everyone was on standby. In fact, people were calling in saying, hey, listen, can I help?
Now, we're told currently 1 soldier remains here at Memorial Health. Army officials say that she has a long road to recovery, but doctors remain optimistic. Reporting here in Savannah, Nakaya Harris, WSAV News 3, on your side.